Hello and welcome to the global launch webinar for the Universal Nurses Addiction Curriculum. We want to give a special thanks to the U.S. Department of State's Bureau of International Narcotics and Law Enforcement Affairs and the Colombo Plan Drug Advisory Program. Thank you for joining.
We will turn it over to Dr. Joe.
Thank you, Ashley, my former colleague and teammate. Hello, everyone. Good morning, good afternoon, and good evening to you in whichever part of the world you are joining from. It gives me great pleasure to say a few words of welcome on the special and auspicious occasion of the global launch of the Universal Nursing Addictions Curriculum Level 1, or in short, UNAC. Thank you for having me here today in my capacity as the project coordinator for the development of the curriculum from November 2023 till present. I am very happy to share that the entire coordination process was a learning curve for me, with many eureka moments. I am truly grateful for this wonderful opportunity to work with giants in the field, our esteemed curriculum developers and expert reviewers, not to mention the enthusiastic nurses involved in the Thessaloniki pilot in June 2024. On the same note, we are indeed very honored to have Dr. Pamela Cipriano, Dr. Laurie Crom, and Miss Joanna Travis Roberts with us. Their presence adds great value to this event. Also, our respected colleagues and friends in the audience who have been directly or indirectly involved in one way or another with the UNAC development. And not forgetting those from the nursing community who took time to register and show up at this momentous event. DTR colleagues and friends, today's webinar launch is yet another significant milestone for the Universal Curricula. We are excited to unveil the latest evidence-based curriculum and lay it on the table alongside its predecessors. Yes, the wait is over. Introducing the most exciting launch in quite a while, the Universal Nursing Addictions Curriculum Level 1, UNAC, to everyone present here, particularly to our nursing fraternity. From the word go, get ready to enhance your professionalism in the field of addiction nursing. Avail yourself of the training and write the ICAP RN when the opportunity arises. Upgrade your professional life. Take it to the next level. Stay ahead of the learning curve with this cutting-edge innovation. Elevate your work experience. Unlock new learning possibilities with the UNAC. It is more than just a product. It is a real game changer. Having said this, today's event will only be but a dream, if not for these two giants in the nursing curriculum community. Because of them, this launch has become a reality. Sincere appreciations to Dr. Carmel Clancy and Dr. Coran Berda. I named them our modern Florence Nightingales when we first met in Washington back in November 2023. Your dedication and commitment to the entire curriculum development process, from start to finish, knows no bounds. I have no words to describe. You both are simply amazing. While I will leave our curriculum developers to delve in detail about its content, structure and delivery, learning outcomes, etc., during the walkthrough later, let me underscore the global significance of the UNAC initiative in enhancing evidence-based addiction course within the nursing education. Firstly, like its predecessors in the field of prevention, treatment and recovery support, the UNAC that falls under the umbrella of the treatment series for specialized populations embodies the current trend of training materials that are informed by empirical evidence and research findings, rather than hearsay or gut feeling. Additionally, I see it as the forerunner of many more new curricula in the pipeline for pre-service nurses, as well as ongoing professional development and support for in-service nurses. If I may add, it can possibly complement and supplement the newly launched WHO Practical Guide for Pre-Service Education and many existing and similar nursing curricula that you are familiar with and which I am unaware of. More importantly, ICU-DDR and ISUP will take up the key role as UNAC rollout partners moving forward. Thank you, Laurie and Joanna, for receiving the baton so graciously. We appreciate in advance the efforts of you and your teams to steer the UNAC rollout to greater heights than ever before. Through the education provider system of registered university, colleges, and tertiary institutions, and approved training providers comprising government training partners, NGOs, and training organizations, the UNAC will achieve a far wider reach beyond Asia and the Pacific, Europe, and the Americas. We are hopeful that the numbers of trained and credentialed nurses will increase by leaps and bounds within a short time frame. Colleagues and nursing friends out there, the sky is the limit. There are no borders, no boundaries. The world is your playground. The only thing between you and the UNAC is your imagination. Take up the challenge. Make the UNAC an art above the rest. The future holds great promise for those ready to answer the call to become professional addiction nurses. With this, I rest my case. With all good wishes for a successful launch, until we meet again later in the session, thank you for your attention. And now allow me to give the floor to Dr. Pamela Ciprino, who will deliver the keynote address. Over to you, Pam.
Thank you so much, Joe. Let me get my slides up. There we go. So good morning, afternoon, and evening, everyone. I'm so pleased to be with all of you today to support the phenomenal work that has been done in creating the UNAC. And so this is really an opportunity to celebrate this great achievement, as well as look at how all of you can become involved. I want to start with reinforcing the fact that we all believe that healthcare is a human right. Some countries do a better job than others in terms of assuring that human right. But it's interesting to note that even back in 1946, when the World Health Organization was conceived, that the issue of complete physical, mental, and social well-being was included in the Constitution. And we know that individuals with mental health and substance use issues are not always included. We know there are tremendous health disparities. But again, it's been reinforced for many, many years how important it is that we have a holistic view. So as you hopefully will hear in very short order, the aspects of the UNAC curriculum, I think it will be absolutely obvious how important this is. And I'll go over some reasons why I think so too, as we're talking this morning. The acknowledgements that I think are necessary. You may know the origins in terms of the funding and support, and it has already been identified for sure to really commend Dr. Clancy and Dr. Berta, because they've done amazing work aided by an expert nurse advisory group. So I want to share just a little bit in terms of the International Council of Nurses. And before I keep going, just to let you know, I will unfortunately need to leave you after the conclusion of my presentation due to other commitments. But anyway, the International Council of Nurses, of which I've just completed my term as president, has been very vocal on mental health nursing, as have other groups within the World Health Organization and others. And we all know that with the exposure to extreme stress and fatigue during COVID, the whole world recognized that we've added additional stress to all healthcare providers as well as the public. And mental health nursing is a really critical role in terms of being able to mitigate and address those concerns. And it always has been, but is now even more apparent to all of us. And you cannot separate physical and mental health, which you know. And so the position that ICN has placed in its guidelines on mental health nursing is to really bring home the point that all nurses have a role in mental health and substance use. And so we believe it's important that at the basic and continuing and advanced education, that all nurses get this educational development in order to be able to deliver care. So some of these things, obviously, you will already know that when we think about substance use disorders, it's not only illicit drugs, it's misuse of alcohol and tobacco, as well as prescription medications. And just like cancer, addiction does not discriminate. I put this one note from the United States that our Government Accountability Office added drug misuse to its high-risk list. And sometimes that actually we're seeing in other countries is being called out as a crisis. Now, hopefully you're all familiar with the Sustainable Development Goals, number 3 being good health and well-being. Well, embedded in the goals and actions is 3.5 related to substance abuse. And it's two things. It's making sure that we strengthen treatment, but it's also that we give people access and make sure that they are covered to receive care. Because once again, we know there are significant disparities. When we think about the opioid crisis in particular, it has become a public health emergency. And so we believe it's really important that we have a whole of government and society approach. This is a public health issue. Again, we know there are equity concerns. In many countries, it is intimately related to the criminal justice system. And then also, we know there are border issues in terms of the transport of illegal substances. But even more concerning, 600,000 deaths globally are attributed to substance use issues and 2.6 million from alcohol. So we can't ignore any end of this spectrum. We also, you might be all interested in seeing the report, again, this is WHO, that the highest risk for opioid misuse, you'll see the countries there, Australia, Canada, France, Germany, the UK, and the United States. And so we have, again, a number of concerns, and this relates into vast social and economic costs. So it's really important when we think about moving forward that we're thinking about policy advocacy, making sure we're addressing health equity, particularly racial justice, and preventing any kind of issues with housing instability, a lack of ability to get treatment with medications, and overdose prevention. We know that there's evidence for addiction prevention, treatment, remission, and recovery, which is all within the scope of nurses, but really the nurses need advanced education and also accessibility of care. We know that there's much more care being provided with telehealth, which is really important to reach underserved populations. Now, I want to just talk briefly about something that those of you who are in the field of addiction health will resonate with immediately, and that is harm reduction is a critical part of healthcare. And this is a long-standing movement, but again, really needs to reach every healthcare provider, nurses in particular, to recognize this is the direction that everyone needs to be thinking about so that we can reduce the negative consequences of drug use and empower individuals. That's really one of the key principles, and build trust. And why? Why do we believe harm reduction is important? First of all, we know that about less than 10% of people with a substance use disorder ever get the treatment that's needed. And it's even lower in low middle income countries. And some people don't believe they need treatment, can't acknowledge that they have a problem. And so it's really important that we help individuals recognize that they can access health services. We also know that by having harm reduction, we can reduce drug-related deaths, reduce the infections from unsafe injections, reduce other diseases that come with this, like HIV and hepatitis C, and again, increase access to treatment. So how do we do this? This, again, is really critical role for nurses. It's everything from providing education, having safe practices available to individuals that have a substance use issue, providing medication-assisted treatment, which in some countries now has been generously expanded for nurses with special qualifications, reducing the overdose effects, making sure that we're being judgment-free and promoting health services for addiction. Now, why are we pushing the need for all nurses to be aware? Well, as we think about advocacy, we think about two things: making sure we have a well-educated nursing workforce for addiction response, but also we have to understand that primary care is where most mental health care is occurring in just about every country. And so it's important for us to recognize that with primary care as a key entry point and a desire to refocus all healthcare on a prevention mode and do all of the upstream primary prevention, it's just as important, if not more important, for substance use issues. So really looking at how we integrate substance abuse care within primary healthcare will improve access, outcomes, and cost effectiveness. So nurses are already assuming a number of roles. Again, many of you are probably already working in substance use and mental health. But again, you're advocates, you're providing holistic care, you may be a certified recovery specialist. You're looking at advanced practice where it's a much stronger role in terms of how it's been integrated and really helping teach patients and families and communities about prevention. So that brings us to a chronic issue: was where are we with a workforce? Well, we know ICN's publication a few years ago pointed out that 10% or more of global burden of disease is related to mental, neurological, and substance use disorders. However, only 1% of the nursing workforce has any kind of specialized or advanced education in mental health, which is a serious concern. And again, 75% of people with disorders in low and middle income countries are not getting any treatment. Now, this was an interesting report that hopefully some of you have been using to understand some of the nuances. And this is the Global Status Report from the World Health Organization on alcohol and health treatment and substance use disorders. And this shows you what is prevalent in countries. So the first box says 80% of countries actually have nurses available to provide some kind of care, not specialized care. And then the second two say, is there availability of postgraduate training? So 56.6 of countries out of 145 have said yes, but then continuing education, it drops to only 35.9%. So this reinforces why we need to have specialized education. And we need to improve the quality of that mental health education. And the United Nations Human Rights Commission and WHO really point out it should be a priority for educational institutions to prepare nurses with this mental health education. And you'll see a number of recommendations here that it's included in standards. It's part of competency-based education. More hours are included for mental health education. Again, minimum standards for the number of clinical hours and assuring faculty are also prepared. So many recommendations that are consistent with really wanting to embed this curriculum. Now, the other report that just came out on May 12th from the WHO was this second report on the state of the world's nursing. There is a very specific indicator of protecting the mental health and well-being of health and care workers. It's not enough for us just to take care of other people, but it's important for us to protect the nursing public and being able to make sure that they are not only protected from their mental health issues and substance use issues, but also their competencies that is provided through pre-service education. A couple other reports to draw your attention to. Over the last 4 years, there has been a number of reports about protecting mental health of healthcare workers. And of course, you can appreciate, again, with the pandemic, we saw just a terrible erosion of not only mental health, but certainly physical health and well-being as well. And this past May, the International Council of Nurses focused our International Nurses Day publication on caring for nurses strengthens economies. And so another important part of having healthy nurses to take care of people. You know, there are many benefits of addressing the addiction crisis, everything from cost reduction to improved social conditions for people who are affected. And so I want to reinforce the importance of the UNAC curriculum. We need a workforce that has specialized education in substance use. We need to be able to prevent stress and burnout and promote much more self-care. Again, not only for the public, but for our nurses. And so universal addiction nursing education is a key strategy for reducing threats to the public health and security. And so I can't thank the leaders of this curriculum development enough for your foresight and for your desire to really look at how do we ensure that we have an adequate workforce in order to address these concerns. So thank you and congratulations, and I appreciate being able to share a few moments with you today.
Wonderful. Thank you, Dr. Cipriano. I really can't thank you enough for your time and, of course, your own service, having just stepped down from the role of presidency for the ICM. But we're very, very grateful to have you with us for the webinar, and we wish you well, and I hope our paths will continue to cross. Thank you for your time today.
You're welcome. Thank you.
Thank you so much. So I believe we're handing over you now to Dr. Laurie. Do you want to take up the reins?
Yes, thank you very much. My name is Laurie Crum. I am the Executive Director of the International Consortium of Universities for Drug Demand Reduction. We're very lucky to have Dr. Clancy be the Director for our Center for Credentialing and Accreditation. It's an honor to join you today as we launch the Universal Nursing Addictions Curriculum. And on behalf of ICUDDR, I want to express our strong support for this critical step toward global nursing education. We know that nurses are often on the front lines of care for individuals affected by alcohol and other drugs. Yet for more than 3 decades or longer, the evidence has told us the same story. Undergraduate nursing programs do not consistently prepare students to engage with substance use in meaningful, evidence-based, and compassionate ways. A multi-year study led by Dr. Clancy herself and her colleagues highlighted several persistent challenges. Even when students recognize the importance of learning about substance use, their knowledge and skills often do not improve significantly over time. Clinical experiences, especially those paired with underprepared or negative mentors, can even decrease students' therapeutic commitment to working with people who use drugs. In other words, we are asking students to care deeply and do well, but we haven't always given them the tools, support, or role models they need to succeed. That's why this curriculum is so important. It's ready to go. It can be integrated directly into nursing programs, and it helps not only students, but also faculty and mentors who may not have had any training in substance use themselves. It shifts the focus from trying to correct students' attitudes to addressing the structural gaps that limit nursing educators' ability to teach this content with confidence and consistency. This aligns directly with ICUDDR's mission. We exist to strengthen academic institutions as hubs of workforce development and systems change in the field of addiction. We connect science, education, policy, and practice, and we believe this curriculum is a tool that can help institutions do just that. I also want to share a more personal note. Before joining ICUDDR, I spent 20 years at the University of Missouri, Kansas City, and more than half of that time was based in the School of Nursing and Health Studies. While I am not a nurse myself, I worked alongside nursing faculty to support the integration of screening, brief intervention, and referral to treatment training into coursework and clinical practice. I saw firsthand both the energy that students brought to the topic and the barriers they faced when clinical environments didn't reinforce what they were taught. These are not abstract challenges. They are real and they affect patient care every day. That's why this curriculum is such a meaningful development. It reflects what the field has long needed, an accessible, evidence-based resource that equips nursing programs to do better for students, for educators, and ultimately for patients. Thank you to Drs. Clancy and Berta and everyone involved in developing this resource. We at ICUDDR look forward to sharing it, supporting it, and learning from the institutions that adopt it. Thank you.
Thank you, Laurie. And so Joanna Travis-Roberts, who is the Chief Executive for ISUP, is going to address us. Thank you, Joanna.
Thank you. And thank you ever so much for the invitation to be part of today's really exciting and so needed event. I mean, I won't talk about the need because I think it's been articulated so beautifully by previous speakers, but it's really an honor for ISUP to be here to sort of support and say, okay, so how can we help now as you take this out into the workforce? ISUP is a network of almost 45,000 members that are working within the substance use field. And our mission is to unite, connect, and share knowledge across substance use prevention, treatment, recovery. And we really want to make the work of our members as effective as possible by making it easier to discover and share knowledge, training, networking opportunities, and items like this that are coming out and are so vital to the workforce. When we talk about our membership, we really mean anybody who is contributing to drug demand reduction. So that can be volunteers, family members, nurses, people within the medical side, all the way through to research and people that have spent their whole careers focusing on this area. So we want to make sure that everybody understands that they are a vital part of this workforce and of making that change, and that opportunities like this to get that appropriate training out are so valuable. So I will add my thanks and my support to the work that you've all done. We're very excited and we look forward to working with you all to get this out there and here to do whatever part we can play in that.
Wonderful. Thank you so much. I really appreciate it. And thank you both, Dr. Croma and Joanna Travis-Roberts. We're going to, I think, move now to looking inside what is actually this curriculum. So if I could ask Ashley, who's very kindly agreed to take control of our slides. So good afternoon, good morning, good evening. My name is Dr. Cormac Clancy. I have the absolute pleasure of welcoming everybody to this really significant launch. We really are very excited. I know Dr. Berda will say something very similar when she gets to speak, that both of us can't believe that we're at this point. It's been a bit of a journey, and Dr. Joe very eloquently put it, we've learned so much on this journey together. So I'm going to just give you a little flavor as to what that journey has been about, where it started, a little bit about what was influencing the curriculum itself. And then I'm very pleased to say that Dr. Bird is going to take you into a little bit more of a deep dive and give you a sense of what this curriculum is covering. And hopefully that will pique your interest and you will see many things that will be useful, and hopefully you will engage with us and say, right, what is the next step? This is all about taking action rather than just listening. So if Ashley could move the forward, fantastic. So voices behind the vision. I think it's really important to say that this was very much co-created. We hope, obviously, that it's credible. And we hope that what you see once you get an opportunity to engage with the curriculum directly, either as a participant student or candidate, or somebody who will take up the trainer offer that we will be talking about to deliver it within their own curriculum or to deliver it within their organization, you will see that compassion really is the bedrock of the language and indeed the approach that we've taken. So ultimately, the drivers in terms of what we were aiming to do was cultivate an understanding of addiction's impact on individuals, families and societies, along with recognizing the vital role that nurses fulfill within the broader response framework to address global substance use issues. We also, and you've heard very eloquently from the other speakers, the important about how to strengthen nurses' abilities in assessing and intervening. with individuals facing substance use challenges. And this encompasses acquiring proficiency and early identification through effective screening and assessment techniques, as well as motivational interviewing, engagement strategies, which we all know are crucial for guiding the individuals through their treatment and recovery paths. We should say this is a level 1. It's a foundational introductory course. This is not necessarily set up for those who are already experts, but really it's about bringing the broader nursing community into the field of addiction and understanding their role. So it's to empower the nurse to advocate for these marginalized patients groups by fostering interdisciplinary collaboration among health and social care professionals, encouraging their leadership roles and facilitating active involvement with professional nursing organizations, which you've already heard from Dr. Pam Cipriano, but we also have a nursing network within the ISAP group. And there's also very much, and I've been previously past president, the INSA group, which is the International Nurses in Addiction. So if you can move to the next slide, please. So you can see here, Dr. Loretta Ford said very wisely, who is the co-founder of the nurse practitioner movement, nursing is not about what you do alone, it's about what we do together to advance health. And I can't say that anything that, and I'm sure Karan will agree with me, anything we have done was certainly not done on our own, although we spent the hours probably poring over the text and putting it together as somebody has to do. But I hope and pray that we have reflected our community, certainly our community of experts and practice, but also the wider nursing field. And I want to pause at this moment just to share, and you can see the beautiful photographs of some of the key colleagues who were our expert review panel, and again, you can see the sort of the breadth and the depth of that panel in terms of their background, and in terms also of where they were in the world, so that there is a really global lens that was given to this curriculum. And I can tell you, having been on the journey, we started with 7 modules. It was curtailed to 5, but those 5 are really been sharpened by these colleagues that you can see on the screen at the moment. And I'm, along with Karan, extremely grateful for their expert opinion. Many of them will also, you will recognize, members of the INSA group. And I want to acknowledge INSA, having been a past president, that has been a bedrock of support and information, certainly for me, but also in the community. And I'm very grateful for those colleagues from INSA who came on this journey with us. I also want to give special thanks, even though it's been said at the top end, but particularly when we talk about the funders, which was the INL group, but specifically Ms. Charlotte Sissons and Ms. Anchik, who really were the cornerstones of driving this from their perspective. They were wonderful. They got it off the ground. Certainly, Ms. Sissons was the person who, and I'll come to that, I gave her what I call a elevator pitch, saying, you know, there are 28 million nurses in the world. I think if we got even to train a few of those, we could certainly shift and change the dial in relation to the substance use workforce. And she heard that, I'm very grateful to say, and then became an absolute champion in making sure that the funding was made available to take this course forward. And of course, you've already heard from Dr. Jo, who we lovingly call Dr. Jo, but you can see her full title there. She's an educationalist herself, so she was quite modest in terms of what she did, but in actual fact, having her in the background, certainly from the Colombo plan perspective, was extremely important, certainly both for myself and Karan, and we're very grateful for her support on this journey. If we go to the next slide, we certainly cannot say, I think, too much actually about this beautiful bunch of people that you now see on the screen. These were our pilot participants. So you can see all the lovely faces, you can see the countries they were representing. And so we had 14 participants. They're all nurses, some working directly in addiction, some coming into addiction, some with or without experience, some at doctorate level, some coming in with their BSc level. So we really had a diverse and very mixed group, but enthusiastic group, I can tell you. They were hugely important to this process because they very much told us, both while we were doing the training and the pilot in Greece last year at the ISAP Congress, what was being received well by them, but they also highlighted, which was extremely helpful in the editing, post-editing process, what was missing. And I'm, again, along with Karan, extremely grateful for their support in this process. So if we move to the next slide, and this really is just a quick overview, just to show you how the curriculum is shaped in terms of voices and the countries that were represented. So you can see there's a really great spread. We tried to capture as many voices from the different regions so that we were hoping that this curriculum, although it can be adapted, of course, locally, already brings something that people can recognize and use within their respective practice. So next slide. Thank you. So just to give you a quick idea of the roadmap, you already heard that it commenced in 23. These processes don't happen overnight. It's been a little bit of a journey right up, obviously, to today with the excitement of this launch. The large part of this work, as you can see, happened in 2024 when Karan and I, and you will see Karan works out of the US, I'm working out of the UK. So a lot of this was done virtually, where we got to know each other extremely well as we took all the advice from our colleagues and tried to reflect it on the pages that now become the curriculum. If we go to the next slide. So just the missing piece, I'm not going to go into much because I want Karan to have some time to do the deep dive, but I think you've very nicely heard from both, obviously, Dr. Crome and obviously Dr. Cipriano, some of the challenges that exist. So that's really just a reminder that we know that our nurses have just not been trained. We also know that there are three kind of concepts that come together that act as a clear barrier, which is about role support, role legitimacy, and role adequacy. Role adequacy, where our nursing colleagues say, I just don't feel I've been trained enough. The role legitimacy is that it's not my job. Nobody told me about this in my nurse training at pre-service level. And then obviously role support. If they don't feel they have mentors that can support them to take those actions, then people tend to be a little bit reluctant to move forward. So those three concepts critically come together as a barrier. And we're hoping that this training is going to address that. So if we go to my final slide, and then I'll be handing over to Karan, just to say that, as you would anticipate, the curriculum was very much based on a competency-based framework, and very pleased to say that there are many excellent documents that acted as references for us as we built up the curriculum from the perspective of many experts already who have looked at the role of the nurse, looked at the competencies, particularly the knowledge, the skills, and the attitudes. And as you can see, right up to recently, the announcement of the educating medical and nursing students to provide mental health, neurological, and substance use care. We certainly, and I certainly, along with ICU-DDR, had some input looking at that work as it was forming. And certainly you will see that the 12 competencies that are mentioned in that document, which was launched just earlier this year, indeed just last month, is reflected in this curriculum as well. So I'm going to hand over, I believe, now to Karan, who's going to take a bit of a deep dive. Perfect. And welcome her to the presentation.
Thank you.
Thank you.
So excited to be here and to share with you the nuts and bolts a little bit. Everybody wants to open the manual and see what's really in there. I'm going to give you a little glimpse of the what and the how. The exciting part, as you know, it is a game changer, because unlike other in-services and trainings where you're in with substance use professionals as a group, and what nurses offer and what nurses do in terms of being one-on-one with patients for most of the time is very different than what other people have, or even in introduction, because we believe that any door in the healthcare system that the patient opens should be a door that is able to treat and refer and care for them and acknowledge all of the diagnoses they have, not just the diagnosis that brings them maybe to the hospital. So every nurse everywhere we want equipped to handle people with substance use disorders. And the important part is to look at their attitudes and their responses. This whole program, as you've heard all morning, it's designed for nurses and designed by nurses, and lots of nurses. I mean, I'm sure there are a lot of people here who have been waiting for us to stop asking them questions. What do you think? What do you think? Next slide, please. I was really focused on the graphics. Carmel and I went round and round. There's so many stereotypical ways to represent nursing, and we didn't like any of them. We wanted something that really said what we needed it to say. And we came up with this explanation, but we went searching for somebody who could do the graphics for us. And hilariously, on this journey, there were so many surprises, and it was exciting. It was tedious and frustrating, but it was mostly just meeting lots of new people and making friends and having surprises at every turn. We went to the University of Middlesex, where Carmel was the dean. We went to their graphic design students, and the faculty kind of led us to several students that would have been appropriate to help us with some designs. And we wound up choosing Christian Vahada, and he was very interested, and he created several designs for us to look at, and this is the one we chose. The really funny part was that Christian revealed to us that both of his parents were nurses, and they were very involved in helping him with the graphic design piece, and he was more interested in their approval as much as he was for our approval, and we just love this one. So navigating the decision to seek treatment embodies courage and resilience. Similarly, the commitment to provide treatment daily showcases dedication and compassion. Regardless of your role in this journey, recognize that you are part of a supportive community. The graphic theme on the front of the manual highlights a central figure, whether it is the individual embracing treatment and recovery, or the one offering the support. But surrounded this figure is the numerous allies ready to provide encouragement, even if their presence is not immediately evident. Know that you are embraced by a network of caring individuals, each with their unique strengths and contributions, committed to empowering you in your journey as a competent and empathic nurse and a lifelong learner. And I think we really wanted all of our students to know that they're not alone, and that their professional organizations were great places. ICU-DDR is going to be, really promoting ISUP, working together and having more and more people connecting to give people the support on this journey is really important. So really proud of the extra time and effort it took, but I'm so pleased. Carmel and I were so excited when we picked the right graphic. Thank you, Ashley. Next slide. So what's inside the toolkit? What nurses will learn and do? We have the 5 modules. We have multi-formatted learning, which was flexible, accessible, and engaging. And we have a lot of additional materials. And we had several countries who had different criteria for in-servicing. Some countries wanted 3-day service, they wanted a 3-day in-service. Others need 5 days in order to consider it an adequate in-service for their nurses. So we came up with a program that is very diversible. It devised 3-day to 5 days, and we added different activities and things that could be done locally, which I'll go over a little bit next. So this is a look at what nurses will learn and do, and this is in the trainer manual. There's 2 manuals that we did. They're different. The first manual is the trainer manual, which has a lot more detail, and it has say text, which I'll show you in a minute. There's also a participant manual, which is for all the students. So that's written a little differently and written for the student versus the trainer. So we're evaluating everything the whole time we're doing everything. We're getting feedback from everybody on how things are going. We are looking at the modules. The module titles will come up next, and I can explain a little bit more about those objectives. But we have appendices, and each of the appendices, if you could, it gives them a little bit more information, a section on how to handle challenging students, how to get them to do more community work or work together in groups, and kind of giving them tips on making them more cohesive and open when they're communicating. Here's the 5 modules with their learning objectives. The first is the holistic nurse, embracing addiction care in every setting. That's every door is the right door. And one of the things that we stressed throughout is exploring their own prejudices and their own negative attitudes. We can give the knowledge, and we can start the skill sets, but we can't really get the work to make an impact without changing their attitudes. Many of them didn't have that foundational understanding of why recovery is so difficult, why there are so many relapses in the road, why are they always failing, how does it, how does all of this really work? And it really impacts the way that they approach a patient, the way that they respond, the way that they have resources available, so they know what the expectations are. We know that it's going to stop and start, just like any other big change. You don't fire a diabetic for eating a piece of cake. You don't throw up your hands and say, we're not going to work with you anymore. I've watched many people get fired from practices, and it shows that they have a lack of understanding and a lack of a skill set to pursue health and meet goals, no matter how small they are. So that worked. The students used reflective journals throughout the process. They really had to buckle down. One of the things that came up in our feedback from the students is we got to a point where we were very, very open and honest about our feelings, and they told us how afraid they were to work with this population. This is a special needs population. You have to have special skill sets and patience and a different way of working than you get in your general foundational nursing. So that's why we brought out holistic approaches. We do relational nursing. So we are really about a therapeutic relationship that allows patients to tell us honestly what's going on. I relapsed. I've got all of these stressors. I don't know all of my barriers, but I want to work with somebody who can help me with that. And so those are the things that really make a difference. When you look at the poor outcomes for treatment centers, we can say part of those poor outcomes have to do with not having educated, experienced practitioners. And this is the start of being able to do that. It is one thing for us to educate the nurses. It's quite another for us to enlighten the institutions themselves. The institutions have to be supportive. They have to say, that they give the time and the expertise to their nurses within the way that people are processed through their healthcare system. And that's, another big challenge ahead for us. What else? The second module that we did was the basics in nursing practice. So we went through and really showed the multiple ways substance use disorders affect individuals' holistic health. And we got all the physiologic, biologic reasons. Then the relationship nursing, a lot of trauma-informed care, a lot of navigating the stigma in the public stigma as well as individual stigma, the nurses' stigma, healthcare stigma, and then how to deal with those tense encounters with patients, how to respond, how to reword things, because words are power, right? So you have to be able to respond in ways that engage rather than push people away. And then expanding the nursing roles and the responsibilities by having them learn SBIRT and learn how to do the referrals, the screenings, the brief intervention, and integrating all of that into their own nursing practice. We ran out of time, so we created a coaching module. After they finished the in-service, we created a coaching module and we worked with them for several months post meeting on Zoom, and really seeing that they had gotten their institutions to use different evaluation forms and adopting the assist tool and using SBIRT in their places of work, which was so exciting. Next slide, please. So every one of the modules has a time session. This is for the trainers so they know how many minutes they should give to each of the presentations, and where all the topics are going to fall, so that it goes in sequence. There's expectations for each piece. We don't want people freelancing when they take over the training. We want them to follow this program because we know it works. And then there's always small group exercises for the student. Next slide, please. Supportive information with the presentations. So every trainer would get a slide giving them the reasons for the slide information, the data, the evidence-based practice, the teaching instructions, and then the say text. If they're don't have English as a primary language, we told them exactly what they needed to say. They could review it and say it in their own words, but they would know what needs to be covered. And that was very tedious, but I think very helpful. Next slide, please. Next slide. Yeah. So these are examples of small group exercises. One about how do things work in your country. The students loved knowing about what other people were doing, what their experiences were. It was great. And then new discoveries in the different modules and what surprised them, what encouraged them. Those kind of small group discussion and then sharing. Next slide, please. Good. I was worried we were going to run out, but here we are. Thank you so much for your time and for listening. I hope you get as excited as we are. And I hope you tell all your friends about it and your colleagues. Thank you so much.
So, Dr. Joe, I think you're going to just guide us through. We're hoping to finish in roughly about 15 minutes, just so that people understand. But we want to give some opportunity for people to have some Q&A and what are the next steps, because that's the action bit. But Dr. Joe, I think we've got a couple of questions. I've been monitoring the chat. So I'll hand over to you because you're going to help us through moderating this piece. But I think if Laurie and Ashley have some other questions that they've spotted, then we can make sure that you've spotted them as well and pick those up. So now is everybody's opportunity to throw questions into that chat. I think one of the questions, Dr. Doe, if I may start, is how do you get access? And that's going to be a classic question. I suspect everybody is hoping to get their hands on this curriculum. So what I was just saying, people may have spotted that in the chat. This curriculum is the same as all of the other universal curriculum that Dr. Joe mentioned at the beginning. It is, in effect, the stewardship of this curriculum falls under ISUP and ICU-DDR. So like all universal curriculum, you will be able to access it. It is freely available, but there are a couple of caveats to that. So one, you can certainly access this information if you are an ICU-DDR member and you are a university or a higher educational institution and you have a faculty that you think that this curriculum could be helpful to, that you would like to take, adapt and train. Then if you're a member of ICU-DDR, you can contact us and we would be very happy to take you through access to the materials and discuss that further. If you actually fall outside of the formal academic side, then again, you would apply through the ISUP group to become a training provider. Now, we are looking at this stewardship at the moment because previously As many of you will know, a lot of this work was supported through the State Department, through grants, and that unfortunately isn't the case anymore. So we are going to be having to look at how that stewardship goes forward so that we can make sure that it is being supported. So I do know that our respective leads within ICU-DDR and ISUP, and I'm sure in liaison with Colombo Plan, will be having a conversation as to how we take that forward. So at the moment, what we're asking everybody is that if you're interested in training or you're interested in becoming a trainer, because you'll need to be a qualified nurse first and foremost to train, and then you'll need to demonstrate your training capabilities in relation to addiction. So a train the trainers will be something that we are working towards. Then we would ask that you contact us, and we do and will be posting an email for training inquiries at icuddr.org, so you can put in a request for us to follow up directly with you, and you can let us know what the perspective is. Do you want us to get in touch with you because you'd like this training to come into your institution, you're a faculty member, you want to drive it into the institution, or you're an NGO, or you are a training provider already outside of the academic framework, a government official, so forth, and you would like to see this training rolled out nationally within your country. We're very happy to have that conversation with you also. So there are multiple ways this can happen. We're also looking to see whether we can provide this training in a way directly to a participant, so that if you're interested just as a nurse to take this course, we're going to look at that. As you know, some of the universal training that's currently available, there is self-led, self-paced courses on the Healthy eKnowledge platform. This particular course is not in that format at the moment. It is it's to be delivered. It can be delivered virtually, but it is instructor led. But that is something that we are looking at the possibility to do as well. So multiple ways of getting hold of it, but we ask to start with so that we can understand your needs and reflect those back to make sure that we can put those structures in place to support you. We ask that you would contact us at that website, at that email address, which will be posted at the end of this meeting. And indeed, maybe Ashley, you could drop that email into the chat now, just in case people have to leave and they're anxious to get hold of it. So I hope that question is addressed.
Yeah, I'm seeing several people ask how this is this an in-service or is this a course? One of the issues that we found in universities and trainings is that there's not that many faculty who can design a course like this. But we can do this as a course. At the University of Maryland in the US, with other faculty, we developed an undergrad course, a 3-credit undergrad course in addictions nursing. And we also did an advanced practice for the MP program and master's programs, where they were taking coursework with faculty, because we were lucky enough to have several addictions nurses at the school. But this could be we can adapt this. It is not meant to be a self-paced course. You need a group to kind of support you through the changes. Like we said, it's really hard for you to look at your own attitudes out inside yourself. So we can do it as a course in a university, depending on what they want, or we could also do it as in-services, depending. Globally, there's as many different global needs as there are people. So this is very dynamic and happening and evolving. So if you tell us your need, we'll tell you what we think we can do.
Yeah. And I think when we say we can deliver it in the university, actually what we mean is you can deliver it in the university with our support. I think the whole purpose of this universal curriculum is to empower our nursing colleagues and community. So to roll it out, certainly we can't meet that need, just a few of us that do this. So we're really wanting to engage the wider nursing community. And I've seen so many of you in varied roles, including a nephrology colleague who's saying that she's doing some work with the youth. So amazing work that's happening. We would be really very happy to have conversations with nurses who are trainers, nurses who are faculty members, who would like to see this reflected within their nursing schools. And it can be, even though it's a 5-module course, there is opportunity for people to pull it apart. And by that, we don't mean, sort of reorder it, because we think it works the way it's written and with our experts' advice. But what we mean by that is that it doesn't have to be delivered in one piece. So you can take the manual, and if it's easier, you could align the modules, for instance, throughout different semesters, for example. Or you could get your students or your nurses to take it as an in-service training, but over an entire year. There is nothing saying that you have to take it in 3 days or 5 days if you wish to extend it. But we give a lot of that advice and guidance within the manual itself to help the trainer understand how they can meet the needs of their particular population or constituents. So, and that's, I think, what Karan is sort of saying to you. If you send us an inquiry, we would be very happy to guide you and to suggest how you can take this material further. We certainly will be working with our colleagues with Colombo Plan and ISIP and ourselves within ICU-DDR to establish as quickly as we can, and hopefully during the summer, we will put out an announcement for a Train the Trainers, so that those who wish to actually then embrace this curriculum and run with it, they can have a walkthrough with us and feel very comfortable with the material to then take it forward within their respective institutions or countries. So that is certainly something we're hoping to do. We also have had a lot of interest from our colleagues, both on the expert review panel, but also in many countries, is this in English? I suspect, I haven't seen that question, but I suspect it may be there. At the moment, unfortunately, and Dr. Joe knows this, there isn't actually funding available to translate it. Some of the universal courses have been translated, but we haven't had the opportunity to secure funding at this moment. But that doesn't mean that if there are people who feel that they have an opportunity that they could translate this and would like to talk to us about translating it, Spanish, French, Portuguese. I can see Dr. Sibra is with us, and I know that my colleague, Dr. Givini from Brazil, who are both Portuguese speaking, I know that they're very keen to look at how this could be translated into other languages, along with our colleagues, certainly with Spanish as their primary tongue. So that is, again, something that we're hoping to pick up. And if there are any people out there with lots of money who would like to support that initiative, I'm sure you're going to hear all of us say, that would be wonderful if you felt that you know somebody who would like to take this material and translate it in your respective language. And maybe there are Department of Health people here, government officials. I know that that's very brazen of me to say this so openly, but we are at a point in the world where this sort of support is required. So if you know of anybody, a benefactor who would like to support that, then again, that's something we'd be delighted to hear from you. So I'm just checking, are there other, because I'm just aware of time, are there any other key questions, colleagues, that you've spotted that perhaps we haven't picked up?
I spotted one that said many nurses may not want to be addictions nurses. And we're not asking that you become addiction nurses. We're asking that you look at your own experiences and maybe do some stigma work and maybe learn some different responses and understanding this population's need in terms of their approach that's required in order to make them successful on their journey to recovery. So I'm just saying there are different skill sets that would make recovery more possible if many of us were more trained. And someone asked about midwives, or we keep talking about nurses. In the US, midwifery is within nursing. I don't know if that's the same.
Yeah, it's not the same. So midwives are very much a different discipline, certainly from a UK perspective. But it's a great question in terms of that discipline. I would say that there is there's a lot of translational stuff here that, you know, if you were a midwife, I think that you would look at this manual and say, you know, this translates very nicely with a little bit of adaptation, I suspect, and of course a lot more around the maternal health and the care of prenatal and postnatal sort of scenarios. But certainly there is a lot here that midwives, I think, could use, and we'd be very happy to have that conversation with you. I do think, you know, Karan's point, not everybody, or the comment that not everybody wants to be a addiction nurse. I'd say, why not? I'm going to challenge you back. Why not? Given the ubiquitous nature and the prevalence of addiction and the impact it has directly and indirectly, which you heard very nicely displayed and presented by Dr. Cipriano at the beginning, how it impacts both physical and mental health and the comorbidity, the direct relationship between drugs and alcohol on the well-being of our nations. Why would you not want to be an addictions nurse, even indirectly? So I put that back to my fellow nursing colleagues. I believe every nurse is an addictions nurse. You may say that that's understandable, but I do think fundamentally every nurse, if you look at this curriculum, the skill set that we're asking people to embrace and understand is really fundamental to nursing care, in my view. And that is where we hope that this curriculum will start to breach that understanding. So I'm gonna pause us because we really have overshot ever so slightly. If you could just put up the last couple of slides, which kind of hopefully share some of those key messages, but also kind of the call to action. And if you missed the email, it also brings that up. So maybe Ashley, if you could put the next slide up. These are, again, if you've came in on this webinar a little bit later or halfway through, you may have missed some of the earlier key messages. Hopefully you'll take the opportunity to review the entire webinar again. But I think really we want to leave you with these messages. So addiction is a global health crisis, and nurses play a key role as part of the response framework. I hope that we've been able to present that argument today. UNAC fills a critical educational gap with evidence-based, trauma-informed, stigma-sensitive training. It's been developed by nurses for nurses. UNAC reflects global best practices and is adaptable across multiple practice settings. With input from over 17 countries, we believe it's a testament to the power of international collaboration. And we strongly suggest that by strengthening nursing education, we strengthen communities and we believe save lives. So if you could go to the last slide, and we'll leave that sort of up. This is really giving you that email address, training requests at icuddr.org. If you have any suggestions on hosting or attending a UNAC training, becoming a certified trainer, integrating the curriculum in whatever shape or form you believe it's going to work for your institution or your service, or indeed your country, we would absolutely welcome a conversation. We hope that you will be a champion for change by sharing the launch of the webinar, advocating for addiction education in nursing policy and standards, and start, if you haven't already, or continue to lead the conversation on SUD stigma, equity, and compassionate care. Together, we're building a healthier, more informed SUD nursing workforce worldwide. I am very grateful to everybody who's attended today, very grateful to Dr. Jo again for her welcome address, and to all my colleagues who have spoken. We wish you well for the rest of your day. If you're heading to bed, have a good sleep. If you're in the middle of your day, I hope that you continue to save lives and continue your amazing work.
I have a question.
We have one question. Okay, colleague, please go ahead.
Okay, first is okay. My name is Masood Ali. I'm from Kenya. I'm a nurse. I'm a nephrology nurse. But yeah, I spend most of my time in counseling youth empowerment, addiction, and mental health. My interest in addiction has become more like I want to divert my nephrology, my dialysis part to addiction. Like if I'm looking for a chance to go study any addiction counseling or recovery. Last month I did UTC training here in Kenya, and I'm enjoying it, the path. That's why I found this webinar. I've joined it. Yeah, addiction is very important, especially here in Africa, in Kenya, specifically in coast region, where many youth are lost here in the drug. Mental health has been raised. So just giving back to paying back the community, like I have that potential to bring them back to their energetic, youthful way. So thank you, you organizers, all of you nurses. That's we appreciate. I appreciate a lot. I appreciate a lot. And if there are any causes, maybe any training, any grant, I open my organization just free for the community, for the youth, for the mental health services and substance use, just to give them hope. Yeah.
Well, thank you, and thank
Yeah.
you for your wonderful words, and thank you for your work, and particularly for your generosity. It sounds. I can tell you that Kenya is an amazing country. They are doing fantastic work in Kenya in the SUD workforce area. We have wonderful connections with Kenya through ICDDR and ISAP. So if you wish, please do send us an email. We'd be very happy if you're not already connected with some of those colleagues to send you there to do some introductions and to make sure that you're connected with those colleagues. Kenya is really, sort of flying the flag a lot, I can tell you. So if you're not aware of that work, we'd be very happy to share that with you. Wonderful work happening. So I see people want to have some questions, and I'm happy for us to stay on and take those. I just think if people need to leave, please don't be embarrassed to do so. We are very grateful for your continued interest. We can certainly hold on for about another 5 minutes to about 15 after the hour to take some more questions. So if people are happy to do that, I see we have a hand up with, is it Angie? Angie, would you like to share?
Hello, ma'am. I'm audible.
Oh, hello. Go ahead. It's Ranjita, is it? Ranjita.
Ji, ma'am. Thank you so much to unmuting me. Myself, Ritu Ranjita Singh.
Wonderful. What's your question?
Hello, ma'am. I'm audible.
Say that
Hello,
again.
Hello, ma'am. I am audible.
Yes, you're audible.
Okay. Thank you so much, ma'am. My question is that at the time of artificial intelligence technology using in medical science field treatment and diagnosis, what should be exact scenario and awareness about diagnosis and primary treatment by using artificial intelligence technology, and awareness about nurses in this particular area and the particular scenario? What exact role in this particular treatment technology and the advanced technology and diagnosis process, the role of nurses in this particular area?
That's a big question. And certainly I appreciate the question because it's a challenge that we're all facing.
Because ma'am, all the nurses is not awareness about this particular artificial intelligent technology in particular area, and don't know about primary treatment, about any diagnosis and the treatment. They should be aware about primary diagnosis and the treatment for nurses. The awareness program in training through a nurse, through by doctors and the academician and the scientists for the nurses.
Yes,
That's my question.
Yeah, in actual fact, I don't think I'm suitably expert to answer the question about AI and all of the amazing technologies that are happening currently. But I will acknowledge your statement that you're absolutely correct. This needs to be reflected in curriculum, whether it's nursing curriculum, medical curriculum, social work curriculum. And so I would suggest that there is a huge opportunity for interdisciplinary curriculum to be developed around the issue of AI and approaches in treatment. And I certainly know that through ISAP and ICUDDR, we're always very interested in looking for insights into that and considering training. So we'll certainly, I think, take it back. I don't know if any of the panel would like to comment further on that, perhaps, but certainly I think you're correct. It is a massive challenge at the moment that needs to be reflected going forward to future-proof curriculum, so that our current students and future students are prepared for the 21st century care system. Thank you. Angie.
Thank you so much.
You're very welcome. You're very welcome. Thank you for the question. I think Angie has a hand up, but I'm not seeing that she's coming forward unless she can unmute and help.
Hello.
Hello.
Yeah, okay. This is Joseph from Liberia.
Hello, Joseph.
I'm good that I've joined. Thank you very much for the webinar. I think the sustainable way of training addiction professionals is integration of the training into training institutions or the professionals development, like you started with the nurses curriculum.
Mhm.
So this is the way to go. I've admired the comment that you made that there is a possibility for multidisciplinary curriculum to be developed, and that would be very much helpful. Because substance abuse is not a one-size-fits-all. We need all hands on deck
We do.
so that, we can be able to tackle the issue of substance use. So thank you very much. I'm sorry for joining late, but thank you for the
Not
webinar.
at all. Thank you for adding your voice, Joseph, and I concur. Although this is, as you say, this is focused on nursing, because understandably, 28 million nurses, we think that they need some time and we need to give them some direction. But you're absolutely right. This is not one discipline's issue. It's a collaborative effort, both from a multidisciplinary point of view, but also from an interagency point of view. So it's a very strong point to make. And we hope that by raising the standard of nursing education, the nurses will play a significant role within the interdisciplinary work that they are called upon to do. But thank you so much. We really appreciate that. So I'm going to stop, if I may, Dr. Joe, and we're going to conclude this webinar. We thank you all for your attention, for your attendance. I think at one point we reached 200 participants. I don't know if anybody spotted that, but that's amazing. And I think to me, it's a reflection of the importance of the subject, but also the interest. Hopefully that is a real kite mark or a lucky symbol to say that this is going to land very, very well. And we look forward to receiving further inquiry as we move forward. And we wish you a very good morning, good day, and good evening. And thank you, colleagues, for all of your time. Thank you, Ashley.
Thank you,
Thank you very much.
Thank you. Bye-bye, everyone.
Bye.
Thank you.
Bye.